So this is obviously a bit of a departure from the previous presentations, but it's a topic that I'm actually very interested in and have become very passionate about as I've learned more about it. So these are my disclosures germane to this presentation. I do sit on the board for a startup company, Synervention, which markets some of the products which we'll be talking about today. So there's a potential for embolization of a variety of materials during cardiovascular, neurovascular, and peripheral vascular interventions, including gauze or cotton fibers, glove powder, polymers for drug delivery, hydrogel coatings, and plastic sheath materials from catheters or support devices. And when this embolization occurs, it's often a serious problem with significant associated complications. I'm going to focus specifically on cotton fiber embolization, and the enemy here is cellulose, which is really ubiquitous. It's present in gauze, telfa pads, towels, many of the things that are in our packs and on our tables during our procedures. And cellulose is not ingested by tissue macrophages, so when it's in the body, it's a source of perpetual irritation and causes a cascade of inflammatory reactions, including foreign body granulomatous formation. And it's also a potent stimulus for thrombus formation, can lead to myocardial infarction and stroke, as well as other problems, adhesions, increased propensity for restenosis, and infection. Bacteria love hanging out on these cotton fibers. So these cotton 4x4s that we use in almost all of our procedures are really a problem, and I think are public enemy number one in terms of the potential for embolization during cardiovascular interventions. This is from a case report 2005 in CCI, where a patient was undergoing diagnostic angiography and FFR measurement in the LAD, and after she was taken back to the ward, developed sudden onset of chest pain, was brought back to the cath lab, had thrombotic occlusion of the LAD, and when they performed thromboaspiration, fished out this big cotton fiber, which they presumably introduced into the coronary artery with the flush that they were infusing. This is our good friend, the cotton 4x4, which we use during so many of our interventional procedures. You can get a sense for the kind of particulate that is easily removed from these devices. And this is a telfa pad, which many people think is better than cotton fibers, but actually, as it turns out, it's just as bad an actor during these procedures. So these fibers are in the air. They get on our wires, our catheters, and our gloves, and can easily be introduced onto balloon catheters and stents prior to introduction into patients. For anyone that does peripheral interventions, they've certainly seen this. When we have glide wires get dry, they get sticky, and if you touch them with a 4x4 gauze, we'll see a number of adherent fibers on the guide wire afterwards, and these can, in no doubt, in many cases, then be introduced into patients. This is from Images in Medicine and Circulation from 2000, a patient that underwent LAD stenting with distal embolic protection, in this case an AngioGuard filter placed distally prior to the stent procedure, and when they removed the filter, they saw a number of cotton fibers within the filter, again, presumably introduced into the patient when they wiped the guide wire with the cotton gauze prior to introducing the stent. We don't really know how common a problem this is, but in this one study from the American Journal of Neuroradiology in 2006, they reported seeing particulate embolization in 25% of resected AV malformations in patients that had previously undergone a diagnostic angiogram or some form of neurointerventional procedure. In the great majority of these cases, the embolic material was cotton fiber. In this animal experiment of porcine coronary stent implantation, 6.5% of animals had textile fiber contamination noted on subsequent pathologic evaluation. So what happens when these fibers get into patients? Well, they can be a potent stimulus for inflammation, as shown here in another porcine coronary model where very prominent granulomatous inflammation and giant cell formation was present. And on fluorescent staining, we see the birefringent material, which is cotton fiber, found in the coronary artery. And as already mentioned, these cotton fibers are a very potent stimulus for thrombus formation, leading to stroke and myocardial infarction. In one study from 1997 of patients with coronary stent thrombosis, 42% of these patients were found to have particulate, either glove powder or lint fibers enmeshed within the thrombi found within the thrombose stents. Foreign body embolization seems to be a particularly bad problem during neurointerventional procedures, where it can often lead to major strokes or cerebral hemorrhage. This is from a publication, again, in 2006, of a patient that had a very large stroke and subsequently died. And on post-mortem examination, there were a bunch of cotton fibers found lodged in a small leptomeningeal artery. So this transmission of cotton fibers to these catheters and wires can occur in a number of different scenarios. It can occur with cleaning and wiping the medical device with a cotton-based product, the 4x4 gauze or Telfa pads. It can occur when soaking cotton-based products into procedure bowls and then drawing up the flush into a syringe and injecting it into the catheters or sheaths. It's a practice to be avoided at all costs. There can be medical device contact with cotton towels and procedure drapes, and these cotton towels, which are so ubiquitous during our procedures, also very readily shed cotton fibers. And this particulate contamination can occur from handling cotton-based products with sterile gloves and subsequently transferring the fibers from the gloves to the catheter or guide wire. In many interventional radiology labs and in some cath labs, Telfa is used in place of cotton gauze with a thought that it would be better than cotton gauze, but in fact, Telfa really is no better. And we can see on the scanning EM a free cotton fiber on top of the cotton surface, or the Telfa surface. And in some benchtop testing that we did, we saw similar amounts of particulate debris with Telfa as with cotton gauze, and much significantly less particulate debris with the Swiper device, which is a fiber-free device, which is commercially available, as well as these fiber-free towels, which can also reduce the lint and cotton fiber contamination during these interventional and invasive procedures that we've talked about. For a standard coronary interventional procedure, we often go through anywhere from 20 to 50 of these cotton gauze wiping catheters and wires with a potential for over 1 million cellulose fiber particulate to be released. With one Swiper, we see less than 7,000 non-cellulose particulate. And so we can wipe these catheters and wires with these fiber-free devices and help potentially reduce this complication of fiber introduction into patients. I think we've all seen this practically on a daily basis, where we get this junk on our guide wires, and there's great potential for introduction of this material into patients. And so not only can we avoid cotton fiber contaminant, but we have a device that can more readily clean fibers and debris off of these guide wires, and can also avoid stripping some of the coatings off of these wires in the process of wiping them. So there is a wide body of literature actually about this problem of foreign body contamination during coronary and neurovascular procedures, and I invite you to read some of these articles because it's really quite sobering once you start learning more about the potential for problems with these cotton products. So I'll finish by saying that cotton fiber embolization occurs during cardiovascular, neurovascular, and peripheral vascular interventions and can result in important complications, as we've shown. And to increase the safety of our interventional procedures, we really need to evolve and to modernize and to work to eliminate these cotton-based products from our procedural workflow. There's really no excuse in 2014 for using these procedures. They wouldn't be used by medical device manufacturers during the development and production of these devices, and certainly there's no reason why they should be used at point of care when we're introducing these medical devices into our patients. So thank you very much for your attention.